Thank you, Madam Chair. Secretary Levine, Ms. Boateng, Mr. Hancock, thank you for being here today. Opioid overdose cases are up by almost 300% in York County. And it's during this period of COVID-19, and nursing homes have the highest rate of COVID infections. And based on the Department of Health's website, the opioid crisis and nursing homes are two of your department's primary missions. We've heard here today in testimony that our personal care homes, our nursing homes, they feel ignored. They don't have enough testing, they don't have enough PPE. They're really struggling for resources. So my question to you is, why was this an appropriate time to establish a portal to tattle by citizens on your website, when at this time we really should be utilizing all of our Commonwealth's resources in fighting COVID-19 and maintaining your core missions?
Well, certainly our core mission and our vision is really a healthy Pennsylvania for all. The opioid crisis has been obviously a significant threat throughout the last 5 years that we have been in the administration, and I have been physician general and then secretary. We do have significant numbers of staff that are still working on the opioid crisis. We had a conversation about that yesterday. We continue, of course, our prescription drug monitoring program. One of the things that we would like to highlight, and I know that there's a Senate bill from Senator Brown and Senator Haywood? Williams, excuse me, Senator Williams, is in terms of making legal syringe service programs. Syringe service programs, and this is not safe injection sites, this is completely different than discussed in Philadelphia, but syringe service programs have been advocated by the CDC and Health and Human Services.
And I appreciate that very much, Secretary, but that doesn't answer the question that I'm asking you. The question I'm asking you is, why are we not allocating the resources that we need to things that are fighting this coronavirus pandemic and the opioid crisis, but yet taking these other resources and spending it in ways that aren't really going to have that kind of an impact?
So I have to say, I still don't understand where, Sarah, do you understand?
Senator, I believe that you're speaking about the complaint portal for businesses that aren't following the business order. And I think it is appropriate to talk about that here, because while nursing homes has been the primary focus, it is the focus of this hearing, there are also outbreaks among other congregate care settings. We've talked often with Secretary Redding about the challenging outbreaks that happen at food processing manufacturers, and then the impact on the food supply, not just here in Pennsylvania, but across the nation. So that portal is an opportunity for individuals in Pennsylvania who might work at a congregate care setting like that, to bring to the attention of the department, and then so we can work with our sister agencies to ensure that those workers are safe and that we don't have disease outbreaks in those settings as well.
In addition,
my understanding was that we were well aware of that long before this portal went into place. And so that was already beginning to be addressed by the Department of Agriculture and the Department of Health. I would just really encourage you to allocate resources to address your core functions. You know, having served as a school board director, we would look at things and say, is this a core function of our department? Creating portals to allow citizens to tattle I do not believe, is a core function of your department. Another question for you, Secretary Levine. 70% of cases in the Commonwealth of Pennsylvania are in our nursing homes. There was some conversation, you disputed those, so we'll say 50%. Florida, I am told, has the largest senior population in the United States. They are further along in the reopening of their state, and according to the Kaiser Foundation, Pennsylvania has 3 times the number of deaths and 2 times the number of cases of COVID in long-term care settings than they do in Florida. Their state has also been significantly less restrictive with their closures. So can you please explain the disparities and if Pennsylvania is looking to emulate some of the policies that other states have implemented that are working to protect lives and livelihoods going forward?
So I just want to clarify that the number of cases that we have of COVID-19 that we're announcing today is 52,915. In long-term care living facilities, there are 10,506. So it is approximately 20% of the cases that we have in Pennsylvania are in long-term care living facilities. Where we have the approximately 70% is in terms of the deaths. And that is consistent, unfortunately, with many other states, is that nursing homes and personal care homes, of course, have seniors, almost by definition, and they have many seniors with chronic medical problems, and those are those that are at highest risk of having a significant case of COVID-19 in terms of deaths. But in terms of the total number of cases, it's approximately 20%, not 70%.
Thank you, Secretary. And I think that gets back to the original point, which is we need to put more of our resources into our nursing homes and our personal care homes. Thank you very much,
Sure.
Secretary. Madam Chair, thank you.